And thank God it's not. The last 2 months have been months of struggle, months of stress, agony, looking for the right answers constantly and trying to get the answers from professionals and trying to meet with different doctors and do tests and to find my diagnosis. And as of yesterday, I have a diagnosis. It's the reason why I'm making this video is because I want to raise awareness for men who are suffering from testicular cancer. When I was in the shower a couple of months ago, I was just checking myself up. It's super difficult to talk about, but it's important for people to know and have awareness of this, so every man can check themselves and make sure that you are completely fine and completely healthy. And I pray for you to be healthy, because the past 2 months, the things that I have experienced have been so terrible that I haven't even been able to tell my parents or anybody around me except my closest people. When I was in the shower, I checked myself up, and I saw that there's a lump on my. I found a lump in me, and at first I wasn't too worried. Then I started filling it up a little bit more. Next day I started filling it up as well there, and I knew it was something. I knew it was very like hard, but it wasn't like a change. It wasn't like a different form. It was just like kind of like as big as a kind of, if you take a marble, as big as a marble. So since young age, right, I want to raise awareness for people, if that for men and for everybody that is suffering from something. These things that happen in our life, where you get diseases that are terrible and that you're fighting them, is because most of the times, is what I find, is they happen because of older injury or genetics and so on. I remember when I was 16, I had this issue on my right testicle, I would say. Something happened and I think it twisted or something. And then since then, I've been having this really weird feeling on my right side constantly. Like it's like I would go to bed and literally almost every night, and I have this like weird feeling that's like kind of heaviness or something like going on. You could just feel that something is going on, but you don't know what it is. But you feel something is going on in you. And that weird feeling is scary, right? Because it's not pain, it's not burning something, because if it's burning, it's maybe infection or anything like that. You could treat it easily with antibiotics and so on. But there's these things around our body that we don't notice, like these weird feelings, like itchiness, like something is just not right. You could just feel something is not right. And I encourage every man that's watching this video to go and check yourself immediately if you feel that something is going on with your parts. So I remember I was 16 and this happened, right? And then I was going to like these urologists back in my home country in Bulgaria. I was going to these urologists all the time. I was with my parents as well. I remember one time I went with my dad on an ultrasound. I went with my mom there was some like kind of swelling on the top side, and I was thinking what that is. Why is it more swollen on one side and the other, and so on. Um, and I and I've always had this like weak spot on my right side, right? Very like weaker than the left, right? Only on my parts. And I basically like fast forward maybe 2-3 years again. This kind of small problem started showing up and so on, and I started kind of feeling like there's there's always something that's like wrong on my right side, and it just continued to happen. And that's I'm 29 right now, so just if you could imagine, that is um, that is almost 13 years since that happened. So I was 16. I was going to on ultrasounds with urologists back in Bulgaria, and then um, I just stopped and then continued my life. And then later on in life, I've always felt something, and up until January, this year, and the reason also for like not being able to work properly, not being able to concentrate on things is because of that. I found this lump, as I said, and I found it was about I thought it was about 5 millimeters when I was checking it out. It was kind of hard, and I went to the doctor. I went to a urologist. Thankfully, I have a private insurance through my work, and they were like super quick to get a urologist, so I didn't have to wait on NHS or anything. I'm based in the UK, and the NHS is basically the public healthcare, so I did it privately. I went and it's like a procedure where they do ultrasound before they see you. So I went there and they did an ultrasound, and they looked at the ultrasound, and I'm a 29-year-old male, and I'm used to hearing something like, you're gonna have a cyst or something like that, right? And I go to I wait on the ultrasound, like what's it called, the radiographer to say something to me, but he's not saying anything to me, or she's not saying anything to me. It was the first one because I've done 3. I almost forgot. I've done 4 actually. It was a lot. So she's just checking me out, and she's saying, "Yeah, we're gonna send the report to your doctor later on." And my doctor, I by luck and also by analysis, I am so thankful that I had one of the best doctors in London, and I'm sure he doesn't mind if I say his name here. His name is called Dr. David Nicol. This guy essentially saved me. He's a well-cited urologist since he was 20 years old. He was doing this, and he's about 60 now. He's a chief of surgery as well. Incredible person, very well, very educated, very experienced, like 30 years in the industry. And I went on my appointment with him, and he told me, it was just about a month ago. He called me over the phone, and he said, like, I want to see you. And then we talked about the results over the phone, and he said, so I'm used to hearing, oh yeah, you're gonna have a cyst or something, right? And I go, hey, is it like a cyst or something? I was like super relaxed. I was just out of meeting from my work, and just to tell you how these things can change your life completely. It can turn your life around completely. It can take you from any state that you're in, whether that's happiness, whether that's motivation, where you feel inspired, whether you feel relaxed, calm. It can take you out from any situation when it's about your health. And when this happens, nothing else matters around you. Like, you really just cancel everything around you. You don't wanna. You just completely are invested in your health. And I remember he called me, and he said, it's not really a cyst. And I was like, so what is it? He's like, it's a tumor. And I'm like, what? Like, it's a tumor? And I was like super surprised that I actually have a tumor in me. I was like, well, I guess I guess it finally got me um, when I heard. So he tells me about, we don't know what it is. He's like, I can't give you a diagnosis whether that's benign, which is normal tumor, just good tumor basically, or whether it's I forgot the name, malignant or malignant, basically cancer. So they didn't know what it was, which made me at the same time overthink a lot, but at the same time made me think that whatever the outcome was from that, whatever the result was from that, I would never give up. I would always continue to fight, never give up, whatever the result was. And thankfully afterwards, everything is fine. But that that first time that he told me that I have a tumor in me, I was like, how can I even have this? I can't believe it. I'm 29, and so on. And I started reading online and studies and so on. And I started reading about testicular cancer and so on. Um, and then I went on the appointment with him in 2 days or 3 days. I don't know. It was the same week. I go there, and then he tells me, "Hey, listen, like he's telling me, I think it's benign, but I can't really confirm this for you." He said, "I've looked into the test, and it shows a 8 millimeter, 8 to 9 millimeter, something like 8 point something, tumor that you have in you." And I'm like, "It's on the surface," he's saying. So I was like, "Yeah," because I felt it as well. Um, and he's looking at it, and he's like giving me all types of like different diagnoses, with like all of them including tumor. And I didn't know at the time where, when you hear tumor, the first thing that you think about is cancer, and the first thing to think about is your what is mortality, because as soon as you hear that word, you kind of get like, try to, like, how can that happen, and then you try to think about what is your diagnosis. So you start Googling, you start looking at different studies and things like that, and then you get panicked and tangled up in way more things. But when I was in there and in the office, he told me it could be this, which is he told me Leydig cell tumor, whatever. And as soon as they start talking about cell tumors, and I was like, what? Like that's, and I immediately thought that's like that I was gonna have a heart attack in that room there. And then he starts like giving me some like diagnosis, like maybe 4 or 5 of them, and everything was like super complicated to even like comprehend. And I'm like, so what does that mean? And he's like, benign, right? So benign means that it's a good one. But the thing is, he's telling me it's benign, right? And I'm like, yeah, but he's like, but I can't confirm for you. So I was like, when you look at this, like, what is the percentage of like, what is the percentage that you think is benign? And he's like, in the beginning I was 50-50, and then we did another ultrasound. It was the same ultrasound, but he looked at it again, and he spent some more time, and he said, I think it's 80-20, so 80 in favor of being benign, 20 in being of cancer. So I'm like, and he's telling me the only way to really confirm this diagnosis with testicular tumors is we have to do a surgery. So I'm thinking to myself, wait, and he's telling me the types of surgery. Basically, they have to either, the usual way of doing it is to remove your testicle. That's it, and they remove it completely, and that's the procedure. And then they check the full thing, and they make sure, they take biopsies and so on. I'm so thankful for the doctor, right, in the beginning, because the way he talks, he doesn't talk in these terminologies and things like that. He's just saying, yeah, we're gonna take it out and put it under a microscope and see it. So basically, using words like this can really relax patients, instead of saying biopsy or something like that, because it can really scare people. So we go to, so he tells me this, right, and I'm asking him, can I think for a week maybe, and I can tell you, maybe like a couple of days, and I could tell you. he told me, yeah, for sure. So the way to do it is to remove it. So there's two ways. One is to remove it, and the second is to just partial removal of it. So they can do biopsies from the area and from the actual tumor. So, and the reason, if you hear me rambling around here, the reason why I'm making this video, it's completely uncut, is because I want to raise awareness to this. But so to continue, it was he tells me these two options, and I was like, can I think about it? He's like, yeah, but in the meantime, he's saying, I'm going to send you for blood tests for tumor markers. So I'm like, here we go, we're already starting. And just to give you how everything looks and how I felt at the time. When you get into these hospitals, like the hospital was a cancer patient hospital that I was all the time. It was an oncology, like complete, like almost everybody there was there because of cancer. So everything around you just says cancer, cancer. There was like on the walls, it was like how to write your will, free will writing, and all that stuff. Like I'm just walking around and I'm like completely in that zone now. And I'm like, I don't feel good at all. And I go for the bloods, and they're so nice to you because they know that so many people go there because of that reason. So they're very nice to you, to the point where they're like, it's scary, that nice. So I go there, and nurse sees me. She sees me. I'm nervous, and she said, "Why are you nervous?" I was like, "Yeah, like I just got off with my doctor, and he told me that there's a chance that I might have something going on. So he's sending me to do blood tests." And so I go there, and she starts praying for me, like the nurse, like literally starts praying for me, like starts like, "Oh, I'm really, really praying for you. Hopefully God will help you," and all that stuff, right? And you like, that's incredible, but you're like thinking that, like, wow, like I'm already in that environment that they diagnose patients like that, and they try to make you feel better. And it's like, I was so like I was like, I can't get this. Like if I get this, my life is just completely, it's completely on hold. I'm sure I will battle it and I'll win it, but it's just awful, like an incredibly awful disease. And so they do the blood test, and the blood tests show, the results come. And matter of fact, like they're doing 2 tumor markers, and if one of them is raised, this means that you have tumor in your blood. So I'm like, it's craziness. I'm already like hyperventilating and thinking about life and so on, and also like constantly, even like going to sleep, constantly at work, every time just thinking about this stuff. So they stabbed me here in the arm. By the way, this is from today as well. That's my one of the last ones here, but it's okay now. So I see the blood results. Blood results come in. I am like, they send them over email all the time, and I requested it. The assistant of the doctor sends me the results. They always send it by PDFs, and it's just so stressful. You see that PDF, and it's like, oh, what do I have now? And then I zoom it up, and I see, okay, markers are looking good, so it doesn't seem to be a tumor. But the doctor is telling me, on the other hand, saying, oh, these don't matter. Like it could be these don't matter. He's right. It doesn't matter because it could be in the early stages. You never know. So he's telling me again, the only way to do it is by taking your testicle out or taking it partially. So I start thinking about it, and I delayed. I first had a surgery for in the beginning of February, scheduled, because they scheduled me in immediately after a week. I delayed it. I was like, I can't do it now. I'm gonna do it in a week or something. I felt nervous, basically. The whole thing was, I just didn't make a decision whether I should take my testicle out or not. And it's a very tough decision to make as a man. Very tough, but I'm gonna talk about it more. Let me just check if the camera is recording, and I'll be back. I'm not gonna cut this video. Yeah, it's recording 20 minutes. I think we're gonna do a 30-minute one. Um, and um, I'm making a decision. I'm trying to make a decision for this week whether I should take my testicle out or whether I should partially do it. But now, when I started reading about testicular cancer, and everyone is saying, it's so bad to take it partially because it can activate it. If it's testicular cancer, it can activate it. So I already booked my surgery for partial removal. Right. This means that they just only remove one small part of it. And I'm getting nervous because now I booked the wrong surgery. So when I delayed the surgery and I finally, I was thinking about I was thinking about whether I should take my testicle out, and it's like I'm thinking about it, and I was like, that's, I'm putting my fertility on the line, like 50% fertility on the line, because if you remove your test, people say that you still are fertile and it's all good, but you don't know, you never know. So and my testosterone levels, my mood, and everything, like as a man, to have one testicle is just, it does affect you personally as well. And I'm starting to think about kids in the future. I'm starting to think about, I want a family, and it's going to be difficult for me. Who's going to take me with having 50% fertility being difficult to get a woman pregnant and so on. So I'm thinking all these things, and it's an awful, like, I'm journaling all the time, and it's an awful thought all the time to have. And then I booked my surgery, right, for partial removal already, but because I was reading over online, and I said to myself, you know what, my health is the most important thing. I don't care. I'm making a decision today. I was thinking about 4 days, 5 days. I'm making a decision today, and I was like, I'm taking it out. If it's needed, I'm taking it out. If it needs to be done, I'm doing it. So I go to so about 2 days before the surgery, I get like super nervous, and I call the doctor's assistant, and I say to her, hey, could you help me out? And she's a mom as well, and she knows that I have a mom, but not with me. So she's like, she really felt for me, and I was like, I'm so sorry I have to do this to you. I am going to attend the surgery, but is there any way that I can change the surgery from partial to full removal? So I basically kind of signed off on this to get it out because of my health. And she said, yeah, you can speak to the doctor before your surgery. I didn't know you speak to the doctor before the surgery. I never done that before. But because it's a private hospital, they're really nice about this. So fast forward, it's the day of the surgery. I go, I'll wake up at 5 o'clock or something, because I have to be there at 7. They told me to be there early. So I go there at 7, and I have to wait. About 6:45 I was there. And I had to wait until 7:30 to actually go into the ward thing. And I arrived there, everything is good and so on, and they give me socks and stuff like that, and the robe, and they do a bunch of tests on you and all that stuff. It's kind of comfortable, actually. It's kind of nice. So I sit there, and the doctor comes in, and he's joking with me. He's like, so what are we doing, full or partial? And I was like, I was joking with him first, but then I looked at him in the eyes, and I said, doctor, I completely trust you. You've seen these things so many times, and probably seen 5,000 of them through his time. And I completely trust you, and I put myself in your hands. I said to him, when you open the surgery, when you do the surgery, and when you open it up, and you take it out, and you look at it. I'm completely fine with your decision. You make a decision whether you should take it out, the whole thing, if you think it's bad, or whether if you should leave it if you think it's good, or if it's like not to worry, you should leave it and only cut partial. And he's like, okay, let's just do it in the consent form. So I write it in the consent form. It could saying basically plus full if decided at the time of the surgery. So you go there, they put you on anesthesia. It's kind of nice. They stab you in a little bit. It's kind of nice, and you kind of feel good. You kind of feel like falling asleep, and you're down. You're done. You fall asleep. You're done. And then I wake up. I thought I woke up during the surgery because I didn't know what was going on. I woke up. I was already done. I was already 10:30 in the morning. They finished up, and first thing I asked the nurse near me, I was like, so was it full or was it partial? And she's like, oh, it was partial. I was like, oh my gosh, thank God. To me, this meant that it was no problem, no issues. He decided that at the time of the surgery, meaning that I am fine, because he made a decision. And said, because he's seen so many of them, say, you know what, I'm not gonna take the whole thing. If this was someone else, another doctor, who knows? It's probably easier to take the whole thing, because if you cut it, then you gotta stitch it up and all that stuff. So it's like, the fact that I had such an incredible doctor is really something that I'm super grateful for. Because if it was somebody else, they could have just taken it out and not even think about it, because it's easier for them. So I'm already happy. I'm already on the seventh cloud. Fast forward, I go back to the room that I was. They roll you over there room. Matter of fact, I asked them. They asked me, what pain level do you have? And I was like, well, I have I don't know, 7 to 10 or something, from 1 to 10, how much pain level. So they put something in me, and I asked them, what's that? Like, is it painkiller? I was like, what type of painkiller? Is it fentanyl? I was like, oh my gosh. It's the first time ever taking fentanyl. Never taken anything like this. It didn't really do anything. Didn't really do much, but it was ease the pain, but that was it. But that's on another topic. I finished the surgery. I go back to the room, and then the doctor comes in, and he's smiling around. I was like, doctor, thank you so much for everything. I heard it was partial. He said, no worries. Absolutely. And I said, what do you think? He said, I think it's benign, fully benign. But I can't tell you until the biopsy comes in. So now he tells me that it's no problem, right? Because he's seen all of them, but you never know, because the biopsy, the actual science, will tell you whether that's a yes or a no. Because in gambling and in like statistics, and he was like super fine. He was super. He was joking around as well. He said, if I had to put whatever pounds, if I had to put 200 pounds on it, I would put it that it's benign. So he's telling me that it's okay. But I don't know if he says that to every patient, to just not worry them. So biopsy. So he sent it for biopsy. He told me he sent it for biopsy. I'm all good. I'm leaving the hospital. Have the wound. Still have the wound. And I go back home, and this is the longest 2 weeks I've ever had to wait. This was terrible. The last 3 days, I would go and literally, like, every day I would walk for 2 hours a day around my neighborhood, stressed out, if the results are back. And then I would call his assistant almost every day, and I ask her, are the results back? She's saying no. Then I call again, are the results back? She's saying no. Are the results back? She's saying no. Until Friday, are the results back? She's saying you're in the system, but the results haven't come back yet. Until yesterday, I call her, and she tells me, yes, they're back, but I can't discuss them with you. I was like, oh my gosh, here we go. They're already telling you can't discuss anything with them. This means that it's bad. I open this. She tells me, I'm going to send it to you. Send it to you over email. By that time, I'm completely stressed out. Like, this is basically, these 5 minutes while I'm waiting, this is basically whether you are going to live or whether you're going to die. And not die, of course, now, but like have the chance of like, your survival chance just like lowers when you have cancer. And it's like the fact that this can happen, or that you have to go through chemo and so on, and all of it is just terrible. And I feel for everyone that has gone through this. My life completely flashed in front of my eyes. Like, I realized that we just worry about things that don't really matter in our life. And when I got this diagnosis, I was so relieved, that to the point where I couldn't believe my eyes, what I was seeing. And I just feel for men that are in this situation where you are struggling with the disease, and because nothing else matters in your life than your health. And when you have these moments, you realize how little things are around you, and how you should just focus on the people that you love and the people that you're with, and not care about anything else, not care about the things that people are trying to distract you by, like caring about what people think, caring about who said something about you at work, and so on, and who made a joke about you, or who's being a little bit disrespectful to you. These things don't matter in life. They don't matter. Like, the only thing that matters is your health and your well-being, and your happiness, and your peacefulness, and your family, and the people around you that really love you. And when I say family as a term that people, loving people around you. It doesn't have to be your current family. It doesn't have to be your blood family. It has to be just somebody that respects you, somebody that loves you, somebody that is around you. And I was so grateful that I had these people around me, that when I shared with them that everything is fine, and everyone was so relieved, and it just made me realize how grateful I am to be in this position, and how amazing people are around me, and how lucky I am. So I'll leave you with this: like, nothing else matters than your health. Nothing else matters. And if you are stressed about your current situation, just think about people that are in a tough situation in your life, like people that are waiting on a diagnosis, people that are fighting for their lives. And so nothing else matters in your life. Like, really forget about what people are trying to tell you that you're doing wrong, and how you behave, and so on, and what you've done in your life. Just don't compare yourself. Don't care about these things, because when you continue to compare yourself with others, and when you continue to constantly chase something in your life, you realize that you haven't been living presently. You've been just chasing, and you haven't been there now. That's why one thing that I could say is just be grateful for what you have. Have gratitude for people around you, and really appreciate every moment you have around. And because that's what's the most important thing in your life. And if you have somebody, if you're lucky enough to have a partner that loves you, if you're lucky enough to have family that loves you, and to be around you in these moments, and support you in any way, in any form, I'm happy for you. And if you don't have those people, and if you don't have these connections around you, if you don't have the life that you want, just be patient. It will happen. Of course, work hard for it, but don't ever forget the present. Don't ever forget the now, how you feel, and what things you're stressing about. Like, start journaling, and like start like writing things out, and say why you're feeling the way you feel. And then you're gonna start excluding these things that are happening in your life that make you feel a certain way. And then you'll see how you're gonna gradually start focusing on the things that you love, and gradually start focusing on people that you love around you. And it's it taught me this. It taught me that nothing else matters. Really, nothing else matters. I went to work today, and I'm working hard, and I'm happy, and I am kind to people now. I'm really kind to people because I'm happy with myself. I'm happy that everything is gone, and that I don't have a disease, and I was so close to getting it. And it just makes you realize how unimportant things are in your life, how unimportant the things that you're stressing about are. When when you fight for a diagnosis in your life, and you look at your mortality, and you realize how important it is to just be healthy and be calm and have people that support you around you. So I'm going to leave you with this to all the men that are currently also thinking about, that you don't want to go and get things checked out because you feel embarrassed, or you feel this or that, or even if you're a teenager, it doesn't matter. Go and check yourself out. Check yourself out. It doesn't matter. You got to check yourself out all the time. So make sure that you continuously do it, maybe once a month, maybe once a week. Check yourself out in the shower. It's not embarrassing to do it. Do it because this is your life. It doesn't matter where. It can get you anywhere. It doesn't matter where. It can get you anywhere. It doesn't have to be there. It can get you anywhere around your body. And if you don't check yourself, you'll never know. And if you never know, you may be late. So that's what I'll leave you with. I want everyone to be healthy, and I want everyone to be happy, and to not worry about, not to go through what I went through ever in your life. And I wish you to be healthy, and I wish you to be well. But please check yourself whenever you have to, and try to do it on a regular basis as well. I'll leave you with this. I wish you to be more present and be around the people that you love, and stop putting emphasis on things that don't matter in your life, on small things that don't matter in your life, and start really focusing on yourself and on your peacefulness and on your well-being, because that's the most important.